Hypertensive heart and chronic kidney disease is coded in category 404. And again, ICD-9 assumes that relationship between hypertensive heart 402 and hypertensive chronic kidney disease 403, whether or not that condition is stated as such. So when the coder has a code from 402 and 403, the coder instead would code from category 404. And then of course the additional codes for with or without CHF, that specificity of CHF, and the stage of the CKD. So you can see in this example, hypertension due to acute systolic CHF and hypertension stage 3 CKD, there are going to be 4 codes. One from category 404.91, one for the stage 3 of the chronic kidney disease, 585.3, one for the acute systolic acute systolic heart failure, 428.21, and one for that congestive heart failure, 428.0. Secondary hypertension appears suddenly and causes higher blood pressure than primary hypertension, and it's caused by underlying conditions such as polycystic kidney disease, hyperparathyroidism, congenital defects of blood vessels. 2 codes are required when coding secondary hypertension. First, the underlying etiology, then a code from category 405 to identify that hypertension. The sequencing of these 2 codes will depend on the circumstances of the admission. So that 4th digit is required, and it identifies that malignant, benign, or unspecified hypertension, and the 5th digit is required to specify that renal vascular disease. And then secondary hypertension in ICD-10, only 1 code, I-15. So other hypertensive conditions. Patients with cerebrovascular disease due to hypertension require 2 codes to be assigned. Under the category heading shown above code 430 in your ICD-9 book in the tabular section will remind the coder of the necessity for that 2nd code. So retinopathy is a degenerative disease of the eye, specifically involving the retina. It can be caused by diabetes, hypertension, and other circumstances. 2 codes are required here. One for the hypertensive retinopathy, in this case a 362.11, and then an additional code to identify that type of hypertension that caused the retinopathy from category 401 to 405. Cerebral infarction, stroke, cerebral vascular accident, otherwise known as CVA. These are acute conditions affecting the cerebral arteries and are coded in category 430 to 437. So although stroke and CVA are used interchangeably, they are technically not the same condition. And CVA, stroke, and cerebral infarction, not otherwise specified in the documentation, all code to 434.91. Pay attention to the exclusion note under code 436, that acute but ill-defined CVA. CVA and stroke used to default to 436, but the guideline was changed in October of 2004, where now CVA and stroke are coded to 434.91 when not otherwise specified by documentation. Unfortunately, 436 remains on the ischemic stroke list because some practices have not changed their coding practice and continue to use it for stroke. But really 436 should no longer be coded when stroke or CVA is documented. If documentation only supports transient ischemic attack or TIA, and there's no clinical evidence of a true stroke, then the code 435.9 would be coded. In ICD-10-CM, these are coded to I-60 to I-69, and there's greater specificity in ICD-10 for the diagnosis of stroke.